Hi class. So this is our PowerPoint titled Prevention of Burnout in New Graduate Registered Nurses, and we are particularly focusing on what interventions are effective in preventing burnout. It is by Megan Campbell, Ashley Cotting, Quinn Ferreira, and Leah Fitzgerald, and we are a part of the Department of Nursing at Worcester State University. In recent years, nurse burnout has become more and more of a problem. It is particularly common amongst new nurses, which is what this PowerPoint is going to be focused on. It is also common in departments of nursing that have, particularly high stressful jobs. For example, ICUs, emergency departments, and also psych units. So in regards to new nurses, their lack of experience combined with an already stressful job leads to physical and emotional exhaustion, and this is termed burnout. In my research, I found this quote that I particularly liked, and it kind of nicely sums up the definition of nurse burnout. So I'm going to read it for you. Quote, nurse burnout is a chronic response to work-related stress comprising three components or dimensions: emotional exhaustion, depersonalization, and personal accomplishment. For most of us, I think when we told our friends and family that we were going to study to become nurses, they congratulated us and told us that, we really need good nurses in this world. So the reason why they probably said this is because a nurse's actions and decisions and quick thinking can mean the difference between life and death for the patient. So with that being said, it's an extremely stressful job when you know the patient's life is in your hands. I found this quote that I want to read to you guys. Quote, the nature of this occupation places nurses into situations where they are often unprepared to handle due to lack of training, ability, support, resources, or knowledge, leading to a high level of internalized anguish. So there are a lot of factors that play into burnout. I listed a few here for you. The first one is short staffing. So we often see this when we go into clinical at, 6:30, 7 o'clock in the morning. The nurses are running around saying, this person called out sick, I'm going to be short-staffed, and you can just sense the tension in the unit, and that's like 6 o'clock in the morning. So it's you're kind of being set up for a hard day. So the second factor I have listed here is lack of quality nursing leadership. So having a good role model, whether it's like a nurse manager or just nursing leadership, can mean the difference between, you loving your job and you hating your job. If your nurse leader is constantly, on your toes and expecting a lot more of you than as a new nurse you can give, it really makes your job a lot more stressful and you really won't like it as much. The third factor I have on here is employee conflict. So if you don't have, good relationships with the other nurses on the unit, you aren't going to want to ask them questions, and it's just going to make for a lot more stressful job if you're always at each other. The fourth point I have here are inflexible policies, and the fifth I have is inadequate pay. So as I said before, as a nurse, your patient's life is in your hands. And sometimes, the pay doesn't really reflect the magnitude of what nursing is. And the last factor I have here is improper work assignments. And I feel like that kind of goes back to the short staffing bullet point. So if you have your hands full with 3 critical patients, and then you get a new admit and you're trying to get through a discharge, it's really not fair, and you can't do the best of your ability during your shift with those improper.
So why is this research significant to nursing? First, burnout negatively affects the nurse personally. So it can lead to dread about working, mental health issues like depression and exhaustion, both mental and physical. And this effect on the nurse then has an effect on the quality of care that is provided to their patients. So the nurses can develop compassion fatigue, which leads to a decrease in the ability to empathize with their patients, and this has a big negative effect of the quality of care received. Furthermore, this creates a safety issue for patients, as these nurses have lower cognitive functioning due to their exhaustion. And so this can manifest as more nosocomial infections that put patients in an even more compromised state of health. And then finally, burnout increases retention and turnover rates, leading to nursing shortages.